beginning, nobody knows, right? So if somebody 2 months ago were to say, I knew that was going to, like nobody knew, right? But I think at this point, though, we have enough data to say pretty confidently that this virus is not the same as all the other virus. It's acting differently, right?
Totally.
We know that with certain people who are immune compromised, who are elderly with underlying condition, yeah, it's not good for them, right? So if you're at risk, you have risk factors, you have to be very careful. You got to wash your hands, you got to social distance, you got to still do all that stuff. But we also know that for the rest of us who are healthy, don't have underlying conditions, it's probably not that big a deal, right? So we saw Stanford study, 3,300 people in Santa Clara County. A lot of them have COVID antibody, but they were asymptomatic, about 50 to 80 times more people with antibody than confirmed cases. We saw the USC study in LA County, testing about 800 people. They came out about similar numbers, 20 to 50 times more people with COVID antibody than confirmed cases. And we saw that in New York as well. A lot of people are walking around with antibody, yet they didn't have much symptoms. So all that is to say, it doesn't mean that COVID is not dangerous. It is if you have an underlying condition. But if you don't freak out. It's going to be okay, right? We don't have to live in fear. I literally have people who are locking themselves in their houses and not coming out because they're afraid to catch COVID. I mean, it's like, there's not COVID raining down from the sky. There's not like a cloud of COVID you're walking into. It doesn't work like that. So that's like unnecessary fear, right? So wash your hands. Don't, let people sneeze on you. Don't lick your hands. Don't do anything like that. And you're going to be fine if you're healthy. And certainly, even if you're not healthy or you want to prevent, you want to just optimize your immune system, like what choice do we have in this? I mean, there's COVID, like you can deny it, you can admit it, whatever. But the choice we have is what you do with it, right? So that we all can improve our immune function by getting sun exposure, by getting out and doing some exercise, by eating healthy, managing our blood sugar, take vitamin C and zinc and D if you need to. Like there's a lot of things you can do that's very proactive that you probably should be doing anyways, that you would do if there's just a regular annual flu season. It doesn't change anything for most of the people. It just changes things for those people who are very susceptible. That's how I see it.
Awesome. That's really cool. And it is confusing. Like I think we spend a lot of time researching it ourselves, and you hear obviously a lot from the natural health profession. And then like I was talking to my sister, she works at one of the big hospitals in Sydney, and they had a case come in of a guy younger than me, and they couldn't get him off a ventilator for like 2 weeks. No underlying health conditions whatsoever, no contributing things. And it's just like, you hear these stories and young people dying, and then you hear then the Stanford study, as you mentioned, that a lot of, it actually appears to be a lot more infectious than it actually is being reported. And so I think people are, it's confusing to where to turn to, but I think what you said there is so, pertinent in the sense of what can we control? We can control and have a better immune system. Ultimately, we don't know how our bodies will react to it. Most of us will be fine, statistically. And if you have conditions, obviously you can isolate more. And I think what better time to have a pandemic really compared to say the flu pandemic of like 1919, no Netflix. So I was watching Netflix. Like no even doing stuff like this where we can all still be connected. We can still run webinars, talk and share information so easily. So I think there's a lot to be thankful for in this terms that this thing could have been a lot worse. If you look back at all like the different viruses and plagues that have evolved throughout humanity, there's a lot nastier ones. So
no, that's a good guy right there, everybody. That's a guy that's great gratitude and cup half full. I mean, your cup is probably a quarter full. I mean, you got a lot. That's great. I love the way you think, Matt. I mean, yes, it's kind of like, hey, it could be worse, right? We could be locked down with no internet. So yeah, it could be worse. And also we know a lot more of what to do from a natural perspective to improve your health than we did in 1916 or whenever the last Spanish flu was. So yeah, I mean, I don't think, so therefore, don't live in fear. It doesn't mean like you're stupid and go out and just like do stupid stuff, but take care of yourself. And I think we're going to be fine. I think the collective consciousness is that, I think as a whole, I mean, to be honest with you, we live on a rock, hurtling through space at however hundreds of thousands of miles, right? Being on planet Earth has risk. I
Yeah.
mean, there's lightning, there's sharks, like we don't worry about.
Come to Australia, mate. We'll show you how dangerous life can be.
I'm in the middle of the desert, so I don't, the risk of shark attack is pretty low for me. But I mean, you drive a car, you have risk. So there's risk in everything. Of course, we have to put that risk into perspective. But I think if you watch too much news and you watch the wrong news, you can think like the world's falling apart. But I don't think this virus is like a plague or something. It's just
100%.
for a certain population really badly. So let's improve those population. Why don't we, right?
100%. Yeah. Me being like the nerdy geologist, I think of my geological record. I'm like, there have been a lot worse extinction events that have happened through our time on Earth, as long as life's been around on top of Earth. So I think we'll get through this. And obviously it's tough economically. Like the economic side of things, I think, is a whole other side of this conversation. A lot of people are struggling. And there's not a lot we can do about that as well, in the sense of, we will eventually get through this. This is a bad recession, but hopefully we can all support each other. And maybe this is a time where we can be less individualistic about our money, that we can learn to share and be less attached to it. It's just an idea. It's just, at the end of the day, it's government's printing dollars. So what we have is our family, our friends, and our health. That's the most valuable thing that we do have.
And Netflix.
And Netflix. Yeah, we can't forget Netflix. Cool. Well, thanks for sharing that. And when you say things like collective consciousness, I get super excited because I'm like, oh, whenever you talk, there's always some like sage-like wisdom
to take.
Like last time we spoke and you mentioned about what is our illness teaching us. I think that was a big learning point for our community. So anyone that's on the call right now, you're about to, be prepared to spiritually, physically, mental evolution. A bit of Khan.
I'll do my best to live up to it.
A bit of pressure now.
All right. So question 1, this comes from Andrea. She says that, so her pain points at the moment, and in the last 2 months, she says she's getting bloating, abdominal discomfort, extreme tiredness, aching joints in hands and feet, and anxiety symptoms. She gets migraines, usually one before or after my period starts. She's breastfeeding a 20-month-old son. She previously, since she was 15, she had trouble with IBS, possibly SIBO, not sure, always migraines, but she's been taking Megaspore twice a day, and she's been doing a plant-based diet, sugar-free, wheat-free, dairy-free, which has pretty much fixed my IBS and leaky gut. But she's saying in the last 2 months, she seems to have spiraled a bit. She wants to know potentially what sort of testing should she do? Is it better to do something on her own? Should she wait till she's finished breastfeeding? So basically, she's got a whole bunch of symptoms, mostly related to gut, but then doesn't really know where to start. Okay,
so that's a great first question. And so, I talk a lot about, like this steps, sequence of things that you want to do. So a lot of people think like, oh, I have bloating, let me take some enzymes or probiotic. Like they jump straight into it, right? And what happens is sometimes that's not necessarily the first thing you do, because what you have to understand is what's behind it, and more importantly, what else is there. So if somebody has bloating, but then they also have autoimmune, that can kind of complicate each other. Or somebody with bloating, but then they also have anemia. Okay, that complicates things. So there's anemia, then we're concerned about some kind of nutrient issue or maybe an infection that's causing the anemia. And therefore the bloating is just the end result of some infection that's causing that bloating, but it's also causing anemia. So then you got to look for the infection, not just take some enzyme and probiotic and call it a day. Does that make sense? Mm-hmm. So I think we have to get beyond just like, hey, I have the symptom. What are the supplements I can take for it? I think we have to get beyond that. I think, and then my whole purpose is to help people to think beyond that, to ask better questions. And today, as we keep going through these questions, I think I'll have more to contribute. In fact, I have brought my iPad, and with you guys' permission, when it's appropriate, maybe this is not the question to do it now, I will share my screen if it's okay with you guys, where I'm going to draw. I'm going to draw.
Yeah,
I'm going to draw how like things work together. I think having the visual is really helpful. You know, in fact, that's what I do in my own YouTube channel. So if your viewers are interested in watching my videos, it's all free. It's just another great resource for you guys. I draw on whiteboards. That's kind of, but now like with technology, I'm kind of graduated to an iPad, so I don't have a whiteboarding. But you know, most of my videos are me drawing on whiteboard, and I think that's been very helpful for my audience and for my patients to learn what's really going on in the body.
Sure.
So for this particular person, you know, what test would I do? You know, if she has migraine, remember, it's a vascular problem. It's not a headache. Migraine is a vascular problem, meaning the blood vessels are constricting in the brain, and that constriction and vasodilation and the blood vessel changing in diameter is what causes the pain, because there's actually nerves that wrap around the blood vessel. So as the blood vessel constrict and dilate, that stretches the pain nerve fibers. That's what's causing the pain. So really, migraine is a vascular problem. Now, when it's a vascular problem, blood vessel constricting, dilating, what's causing that is really a nervous system problem. It's an autonomic response where your brain and your nervous system can't control that blood vessel constricting and dilating. So you have to ask why. Typically, it could be inflammatory. It could be some kind of toxicity. Now, people a lot of times say, hey, my migraine comes with a cycle. It's not necessarily the hormone that's causing the migraine. It's that the fluctuating hormone level drives inflammatory responses, and that drives that constriction of blood vessel. So really, it's more of an inflammatory issue, but the hormones can kind of cause rise and fall of your inflammation markers. So I will look at the inflammation for her, like what other things going on that could be contributing inflammation. Blood sugar stability is important. For the bloating, you know, if she has history of IBS and doing plant-based diet and helped a lot, that's great. So maybe she can go back to it. If she's breastfeeding, obviously you want to make sure that you're, you know, getting enough nutrients to feed the baby. As far as testing wise, that gets a little bit more complicated. You definitely want to work with a qualified functional healthcare provider, not just a regular medical doctor, but a functional one, because you have bloating and IBS, and those are typically, you know, there's no drug for it, right? And it's not like you have a tumor, that's why you have IBS. It's like you have some functional imbalances. So we need to identify, is there any food? Is there any dysbiosis? Do you have any gut infections? And then use natural things that's safe during pregnancy. So definitely in your case, I will work with someone rather than just take some random stuff. Okay.
Great. I find it curious in her story that she said in the last 2 months, her symptoms have really escalated. What do you think about the impact of stress on our digestion, considering, you know, that's when, you know, the COVID situation really escalated?
Well, I think stress is one of the huge underlooked triggers in this type of audience, right? Because people who come to me and come to, watch your docuseries, they usually already have an interest in nutrition and supplement and natural healing. So they tend to think about, hey, you know, if I can just cut out this one food or find that one supplement, I'm just going to be all good. And they underlook the fact that stress is a big trigger, you know, even from emotional trauma, from previous stressors that they carry. It's all huge. Okay. So, you know, I'm certainly not a counselor, but I recognize how stress impacts people. So that's part of my intake question when I ask people on the first interview, when I work with them in our virtual consultation practice, is that I ask, okay, what's your stress level? What do you do for work? You know, is there any relationship stress? Is there work stress? What about previous stress? Have you gone through divorce, abuse, trauma? Like those things all matter, because let's say somebody says 20 years ago, I was in an abusive relationship and I was really stressed. And ever since then, my health has never been the same. Well, guess what? That 20 years ago can create a neuroplasticity where the body's just stuck in that pattern where constantly stressed, and you don't even know how to not stress anymore because that stress was so big, kind of like what PTSD is, right? So that your body is basically reliving the stress daily, and therefore you can't unwind yourself from that stress pattern. So you're constantly making stress hormone, cortisol, and that's constantly degrading your IgA and constantly causing leaky gut. And this person never gets better until they act. So then we have to do a lot of work to unwind that. Not only work to get them to reposition, reframe the stress, working with somebody that's qualified to work with that mental side, but then also break that vicious cycle of physiology. You know, yes, heal the gut, but we may need to look at, you know, stress hormones. We may need to look at brain patterns, you know, have them do certain brain exercises. We may need to, you know, use anti-inflammatories. There's a lot of things that we might do. The point is stress is a big one. Absolutely, Sarah.
Great, well said. I think it would be a good time to jump into your presentation. Let's see what your penmanship is like, Dr. Khan.
Well, let's do this. I mean, I wasn't preparing to deliver a presentation. I'm here to serve your audience, like Q&A.
Yeah.
So let's bring up another question so we can get through the question. And then when it's appropriate, I'm gonna like start drawing so that kind of make a case. Because I want to kind of use the drawing to help educate that particular question, so everybody can benefit. Yeah.
Okay. Cool. All right. So this next question comes from Kaylee. She says she recently started taking sodium diclofenac for my ankylosing spondylitis. Autoimmune arthritis, and since it's an NSAID, I want to protect my gut. Does taking L-glutamine, D-glucosamine, HCl, HCI, aloe vera, slippery elm, and licorice root help protect my gut and from the long-term effects of this drug, diclofenac?
Yes, that's kind of a short answer. The short answer to that specific question is whether NSAIDs can protect her from, damage to her gut from the NSAIDs. The short answer to that question is yes. The ingredients that she listed, L-glutamine, deglycerized licorice root, aloe extract, marshmallow root, all those things can have a protective effect on leaky gut. Yes, against NSAIDs. However, I will say that if you continue to take the non-steroidal anti-inflammatories, the drug is probably going to overpower that supplement. The drugs are always stronger than supplement. So it'd be like somebody taking probiotic, but they're also taking antibiotic. Well, the probiotic's not going to stop the antibiotic from destroying your gut. It's going to just replenish some, but the end of result is it's just not enough. So the analogy I use is that if you're standing outside in a grade 4 hurricane, and you're outside with this hurricane, with the wind blowing 100 miles an hour, rain going sideways, you're outside with an umbrella that you use on a pina colada. It's probably not, it'll block some rain, but it's not going to do very much to keep you dry. So it's kind of like the analogy is that you can't supplement your way out of a bad lifestyle. You can't supplement your way of taking some medication that's destroying your inner ecology. You still have to work to, it doesn't mean you stop the medication. You have to work to address the root cause. So in her case, the long answer will be, why do you have ankylosing spondylitis, which is an autoimmune disease? What are all the various triggers, and what can we do to help you to get to the point where maybe we can put this ankylosing spondylitis into remission or manage it better, so then you don't have to take the NSAID. That might be a better long-term answer.
I love that.
Really good. With something like a persistent autoimmune disease, is there any, what's some of your most effective protocols in, addressing something like autoimmune disease expressing itself through persistent arthritis?
Okay, so that's a great question, Matt, because you said, what are the things that I do? So yes, so there's these approaches that I take, and I think this is a time that I think will benefit to share my screen.
Sure.
And by the way, is the audience, people that's watching right now, are you guys interested in autoimmune, or are you guys all just gut but no autoimmune? Like, can we just kind of hear, so I know if this is like benefiting just one person or a lot of people?
Yeah.
Okay, both.
Shelley, Julia, saying both.
Okay.
A lot of people have autoimmune. All right, if a lot of people have autoimmune and gut issues, then let's talk about it, okay? Because and a lot of people with autoimmune do have gut issues.
Totally.
So I'm going to share my screen here. All right. So the way it works, okay, is that so the way the autoimmune works is that I think we have to kind of establish what, autoimmune, how does that work? Which means you have to understand basic physiology. So I'm going to just go through it real quick. So in the immune system, you have basically a teeter-totter like this, okay? And on one side, you have these T helper 1 immune cells. So there's a whole bunch of different type of cells that are T helper 1s. Some of these are natural killer cells, okay? So these are like cells that basically go kill the infection. On the other side, you have T helper 2 cells. These are cells that are typically B cells, and they make antibodies, right? So now we have a COVID antibody test. What are we testing? We're testing antibody against certain infection, right? So your immune system make antibody after you have a few days worth of killing the infection, it now tries to remember the infection with antibodies. Okay, so your immune system is constantly shifting from being T helper 1 dominant, more weighted, or shifting to T helper 2 dominant, weighted. So it's constantly doing like a teeter-totter, back and forth, depends on what your body's fighting. Okay, now in people with autoimmune, you're either stuck like this, where the T helper 1's constantly weighting things down, or you're stuck as T helper 2 dominant, constantly weighting things down. So basically your immune system in a Th1 dominant situation, you're constantly making natural killer cells and you're constantly killing, and you can't stop killing. That's why you're autoimmune. In a Th2 dominant pattern, your body's constantly making antibodies and you're just making a bunch of antibodies, so then you become really inflamed. And that's why when you test for autoimmune disease like thyroid, you check for TPO antibody. That's a protein found on your thyroid. So we're looking for antibody against TPO enzyme that tells you whether you have Hashimoto's. Okay. So, or we can test things like, antibody to parietal cells, which is a cell that's found in your stomach lining. So if you have antibody against a parietal cell, then you get what's called a pernicious anemia, which is an autoimmune disease where you can't absorb B12. So this is important because people are either stuck in one or the other. Now, I will tell you though, clinically speaking, what most people have is a Th2 dominant. This happens a lot more common. Not so much this pattern. This happens a lot more common. And the reason for that is because, let me tell you why. The reason for that is because inflammation, from gut infection, drives that. So let's say here you have gut infection. Okay, like you have candida, you have bacteria, you have parasite. What happens, gut infection suppresses T helper 1 killer cells. This is physiology. This is just like in research, we know that the reasons because gut infection suppresses it because infection of any kind causes inflammation. And it's really the inflammation that's suppressing the killer cells. So what happens, remember it's a teeter-totter, okay? So when the killer cells are suppressed, then naturally the T helper 2 cells are going to be more amped up, okay, which they make antibody. Okay, so the correlation here is this. When you have inflammation from any source, whether it's gut infection or remember, when you have autoimmune disease, autoimmune disease equals an inflammatory disease. There's no difference. When you have autoimmune disease, you are inflamed. More inflamed at baseline than people who don't have autoimmune disease. So basically, when you have autoimmune disease, you have infection, whether it's gut infection or viral infection or whatever it is, you're going to become inflamed. That suppresses the killer cell. So now you are immune compromised. So there's your COVID, right? Why some people do bad? Maybe that person who's really young, maybe they got some underlying inflammation that they don't know they have, right? Maybe they don't feel terrible, but they're inflamed. And then maybe their killer cell status is weak. They have low white blood cell count. They have low lymphocyte count. Maybe they don't know that, but that they're immune compromised walking in and they get COVID and now they don't do so well. This is why, okay? So you have these people with autoimmune disease and infections. How many people you think have gut infections? Like dysbiosis and candida and stuff like that. I mean, very, very common. I know because I test this all the time. So then you have these people who are immune compromised. On the other hand, antibody counts up. Antibody count up will drive autoimmune. So if you already have autoimmune disease, this is what you get an autoimmune flare-up. You check your thyroid antibody, it goes way up. You say, why is my thyroid antibody always so high? Because you're stuck in this pattern. You're immune compromised and your antibody protection constantly is driving. Another thing with the antibody level go up is that you get more allergies. You get like allergies to dust, ragweed. Oh, I'm allergic to everything in my environment. I have bad allergies all the time. Like that's the reason. Or you get sensitivities. Oh, I'm sensitive to so many food. I do a food sensitivity panel and I'm sensitive to everything that I tested. That's not because the food's fault. It's your immune system that's driven into this pattern. Okay. You also get asthma, right? Asthma really is a inflammatory and allergic response in your lung. So these antibody level go up will drive asthma. Specifically, also, you're going to be more likely, because of the immune compromise, you get infection and you get allergy, and this all become like, you get problem in hollow spaces. You know what hollow spaces are? These are cavities inside your body. So your sinus is a hollow space. Your bladder is a hollow space. Your gut is a hollow tube. Your lung is a hollow space. Even the vaginal area, vaginal tract is a hollow space. So these hollow spaces more likely to get hollow space infections. So how does that show up? Sinusitis. How many of you here watching today have chronic sinus problems that doesn't clear up, that always have it? This is the reason you're stuck in this immune pattern and you're immune compromised. You can't get rid of the infection in the hollow spaces and your antibody levels up, so you constantly develop allergies, and that's why your sinus never clears up. How many of you here have chronic bladder infections, UTIs? Just put in the chat, just look. I bet there are many of you who get, yeah, I get UTI more than normal. If you have chronic UTI or even the worst form, the interstitial cystitis, that could be due to this pattern right here. Right? So here we're not treating a specific symptom, but we're talking about how physiology works, principles. So if you like understand the principle of how the body works, then you can kind of come to a solution, right? And then how many here have chronic respiratory issues like asthma? Or just constantly get like lung infections, like bronchitis? That's another hollow space, right? How many of you here have bacterial vaginitis? Right? That's another hollow space. How many of you have gut infections, right? That's a hollow space. So the more hollow space infection you get, the more you drive these antibody response, which means the more inflamed you are, infection, the more inflamed you are, more infection you have, the more inflamed you become, and becomes a vicious cycle. So this becomes like, that's why some people go through 10, 20, 30 years, even since their childhood, and they're like 40 and they still have problem because their body can get stuck in this way. This is just how physiology works. It's not like it's broken. It's how it works. It's how it's trying to compensate to keep you alive. But it's a maladaptive response. So you're not adapting well, so you get expressing symptom. So the goal will be then to break this vicious cycle by supporting the T helper 1 cells. There are nutrients that can do that. You want to dampen the Th2 cells. There are nutrients that can do that. You can get rid of the gut infection. If it's bacteria, there's nutrients that do that. If it's viral, then you do something else. There's other things that you can use for viral. And then that's not even to say also to help decrease inflammation. We can do stuff to that too, right? So then now we have these clinical targets. We have a target here we can address with nutrients. We have targets here we can use to get rid of infection, viral or bacterial or candida. We have things we can do to support that. We have things we can do to support that. It's all based on strategy, based on what the individual present with. But this is a very common pattern. I'm not saying everybody has this. I'm saying it's a very common pattern. And by asking questions, we can say, oh, do you have chronic allergies and food sensitivity and hollow space infection? Yep. And you have autoimmune? Yep. Okay, maybe this is more likely the scenario, and then we can go after it. Does that help?
So good.
So good.
Let us know in the chat, guys, if you think that's been really helpful. I think like it's really helpful for at least me to get my head around. Thank you so much.
Mm-hmm.
So many people in our community have these exact struggles and are just seeming like, as you're saying, like symptoms randomly coming up, but have zero idea how it connects. Yeah, so good. That's really, really strong. We've got a lot of people coming through saying thank you.
Yeah, and just so you know, like then we have to plug the person into it, right? Because we're not here treating this diagram. We're treating the individual person, right? And at the end of the day, what we're doing is we're trying to improve people's quality of life, right? Using this clinical model and using my experience and expertise, but it's the experience of like pattern recognition. Oh, I see you have all this stuff through asking very detailed questions. And you'd be surprised how many doctors don't really ask these questions. And then once you have all these data points, you ask all these questions, then you say, wow, this looks a lot like this. Or, wow, this doesn't look like this at all. You don't fit that pattern. Just get rid of that diagram, start another one, right? I mean, I have hundreds of these diagrams on my YouTube channel that I draw out to show people like these concepts. Or it's not really protocol. I don't want to call it protocol, because protocol means like you're doing the same thing to everybody. But it's more like a way of thinking, you know, a way of solving the problem. How do you approach this? You know, you might build a house. Every house needs to start with the foundation, build the frame, and then the roof last, and then put in the stuff on the inside. Every house starts that, you know, go through that same process, but you may not put in the same foundation the same way. You may not put in the walls the same way, but you still got to have a foundation, the wall, and the roof, right? So that helps to guide our clinical decision making.
So good. Did you see all those comments? The crew loved what you just shared. And Julie, client again. She says, Dr. Khan has connected all the dots for me. First time any doc has made sense of my complex situation. So very good, very good. So so say you have, so we had a couple of people post in, you know, yes, I have chronic sinus, or Shelley, for example, said, I have chronic everything, sinus, gut, UTI. Where do you then, I guess, yeah, Shelley is asking, so how do you fix this? And as you just said, not everyone is going to be the same. It's not a same cookie cutter approach for everyone, but in this, what are some principles that you help people guide, you know, because I guess the goal here is like for everyone here to take charge of their own health, and you're here, and I love your mission is to, at least from what we've experienced, is helping all of us know how to think and how to approach these issues. So say someone is here, they're really resonating with what you're saying, and they're like, this makes sense, I have all these symptoms. Where do you start? What is a framework of thinking that that can help our people figure out where to start?
Okay, so like here's another framework. So let me throw another one at you here.
Excellent.
So, and I think this is very helpful because I've done this presentation a lot. I was kind of speaking for a while on this. Here. Okay, so the one of the framework that I use is kind of this roadmap, kind of like a priority system. You know, I think I've talked about this before, maybe in your group, I can't remember, is that there's a priority system for the body. Meaning, like if you see somebody passed out on the side of the road, not breathing, and has a broken leg, which one do you fix first? The breathing, right? The ABC, airway, CPR, we all remember that, right? You don't tend to the broken leg first, you make sure the person's breathing. In the body, there's that triage priority system as well. So if you do things out of order and you treat things that's not so important, that might sound like a good idea, but it's not gonna get the person any better because you have to build a foundation first and then, you know, right? So you don't wanna like, you know, paint the house before you even put in a foundation. That would be completely out of order, but you'd be surprised how many people do that. So the way we do that is, you know, let's say this is a starting point here. So we want to go from struggling to thriving. Okay. So this is what you want to try to get to. Now you can't just go straight up because the way the body works is very complex and everybody's a little different. So there has to be like some kind of roadmap that you navigate so you're hitting the most important things first. So I have this 3 major block that I talk about like this. So the first block is fuel delivery. That's the most important thing that people need to do. So I'm going to give you guys some you know, tips that you can implement right away if you're not doing them already. The second step will be immune function. And the third step is detox. So you kind of have to like work your way up. You know, it's kind of like you got to go through first grade before you go to second grade, before you go to third grade. You know, if you skip it, it doesn't work that great. Now within fuel delivery, the first step within fuel delivery is oxygen, O2. Okay, so what does that mean clinically? Like when I work with somebody one-on-one in my virtual practice, what it looks like is I'm checking for, do you have low blood pressure? Okay, if you have low blood pressure, forget about it. It's not going to work. Meaning you can't even perfuse your tissue, right? Perfusion is king. If you cannot get pressure, which means you cannot get blood to your tissue, you can't deliver fuel, you can't do waste exchange, it's going to be a problem. So a lot of people have low blood pressure. The doctor just said, oh, your blood pressure is so good. You're so far away from high blood pressure. You're never going to stroke out. Well, heck, it's like in the floor, it's in the tank, and it's not doing very good at all, right? So high blood pressure is obviously a risk factor for a stroke and cardiovascular disease. Not good, but low blood pressure is bad too, right? So then they'll say, well, high blood pressure is bad, so lower the better. Well, heck, if lower the better, what's the lowest number you can have for blood pressure? What's the lowest number? 0. 0 is the lowest number you can have. And what does that mean if your blood pressure is 0? It means you're dead, right? So obviously lower is not better, right? So get rid of that idea. So blood pressure has a norm. Too high is bad, too low is bad also. Normal blood pressure is 120/80. If your blood pressure is like 105/65, it's like on the low side of normal, right? It's not low enough for you to pass out, but it's not that great either. If you're like 100/65, that's not good, right? If you're like below 100, if you're like 95 or 90/60 or 90/50, that blood pressure is way too low. That means you cannot perfuse, you cannot deliver fuel. Strike one. We don't even go to second base. We don't even do anything. We fix that first. Okay, that's just so important. Along with the low blood pressure, people may experience like poor circulation. That might be experienced as cold hands and cold feet. Okay, and then thirdly, we check for anemia. You'd be surprised how many people have this low-grade anemia and they don't even know they have it. So that's the first step, folks. So like, how do you check that yourself at home? You buy a blood pressure cuff, check your blood pressure, and just write it down. See what it is. If it's consistently below 110 over 70, consistently all the time, you may have suboptimal blood pressure. It doesn't mean it's low, like, oh my gosh, you're gonna die low, but it's not good enough. Then you have to ask, why is it low, right? Typically, I see low blood pressure associated with adrenal fatigue, viral infections, chronic infections, even autoimmune disease create this, just weak, immune function, low white blood cell count. You're just immune compromised, and that can kind of cause that low blood pressure as well. So I see that a lot. Second step, blood sugar. Blood sugar must be stable for you to feel good. So if you have high blood sugar or low blood sugar, both are no bueno, okay? So high blood sugar will be obviously diabetes, but you don't have to have diabetes to have high blood sugar, right? You could just have insulin resistance, which is like pre-diabetes. Insulin resistance is pre-diabetes, okay? And then on the low side, you can have hypoglycemia. They're all bad, okay? If your blood pressure is not just perfect, your body has very narrow tolerance for blood sugar. If your blood sugar is not perfect, forget about it. So a lot of people like, hey, should I be taking thyroid hormone? Hey, my doctor tell me I should be taking estrogen or progesterone. Oh, I want to take DHEA. Like you're doing the hormone stuff. The hormone is not going to work if blood sugar is not stable and your oxygen is not proper. Like right there. Okay, so how do you manage that? Again, you can check your blood pressure. You can see if your blood sugar is stable. Now, how do you know if your blood sugar is stable? Well, if whether you eat or not determines your energy and your mood, you got unstable blood sugars. Meaning if you don't eat, you get irritable, you get hangry, or if you eat, you get sleepy. Those all means you have blood sugar instability, whether too high or too low. You can have both, by the way. So that's like a surefire way to get started, okay? And the third step here is digestion. What that means, like breakdown of food. I don't mean digestion like leaky gut. I'm not even talking about absorption. I'm just talking about digestion, okay? So that's like chewing. Let's talk about simple stuff. Like people just like don't even chew their food. They just like, they inhale their food. They eat in a rush. They eat in a car. They eat when they don't have time. Like that right there is going to compromise your digestion, right? So you guys do the gut solution. I'm going to propose to you, first step to gut solution is chew your food, right? Eat with like company you enjoy. Eat in a relaxed environment. Like try that, right? Do that first. Because you can't enzyme your way or probiotic out your way out of like not chewing your food. Okay, so do that. And obviously the enzymes is important, and hydrochloric acid, stomach acid is important. Like that's what you need to digest food, right? And bile, don't forget the bile to help you emulsify fat. So like that's the first step. So let me just kind of just pause there, okay? So just because that's a lot to digest, but let's just stop there for a second because I think that's enough for people to chew on. You got to make sure your blood pressure is normal. You don't have anemia. You got to make sure your blood sugar is stable. So you got to eat in a specific way to support that. You got to make sure you're digesting your food. If you can do that, your fuel delivery is going to be improved. You're already going to feel better. And at least, even if you're not all the way better, you have something to spring from, to get better from. Because otherwise, just you're standing on hollow grounds. Like your blood pressure sucks, your blood sugar sucks. Like forget about it. Nothing else is going to work. Forget turmeric, forget glutathione, forget healing leaky gut. You're not there yet, right? Do that first. So hopefully that gives people some perspective and context.
Oh, absolutely.
Fantastic.
Covering those first few things is, and I think it's like sexy to think of these advanced ideas and advanced supplements. And often, I think with human nature, we like complex. We always assume complex answers are better
Right.
than simple answers. We just gravitate towards them. So I think, that's an excellent illustration as to why sometimes simple things, even though it's not the sexiest, but it's
going to be the most effective.
Yeah, 80-20 rule.
Chewing your food, it's not that sexy, but let's make it sexy. Starting with you.
So when it comes to blood pressure, Kaylee is asking, how do you raise your blood pressure? If someone's like epically low, what sort of factors do you look for?
So again, there's things you can do to raise it, but always you need to find out why it's low in the first place. But to raise it, you can simply, use salt in your water, right? So here's a story. I had a good neighbor friend of mine. She was a pediatrician, and she had little kids, and then her daughter was getting like dizzy all the time. And then so like she's a pediatrician, so she's all hooked up, right? So I'm gonna take her to the pediatric cardiologist because she's got a connection. Took her to the pediatric cardiologist. They took the blood pressure. It's like, oh, her blood pressure is low. So here's a prescription, salt tablets. I'm like, did you need a prescription for that? Just take some sea salt, right? So but what I'm saying is the treatment was salt tablet, which is the correct treatment. I'm glad she didn't get put on some crazy drug or anything. That cardiologist at least was like, hey, just take some salt. So you can simply just put some salt in your water, sea salt, and then drink it, and that can raise the pressure. Okay. Another thing that can be helpful for the pressure is licorice root. Licorice root has the effect of increasing the half-life of cortisol. So cortisol hang around your system longer, and cortisol has the effect of raising blood pressure. So licorice root as a supplement can be taken to improve blood pressure. However, I will tell people that you need to investigate why you have low blood pressure in the first place. Is it due to POTS, which is an autoimmune disease, postural orthostatic, hypotension syndrome, or is it due to adrenal fatigue? And then the adrenal fatigue, is it due to viral issues, or is it due to chronic infection or chronic inflammation that's shutting the adrenal gland down? So you got to go deeper than just taking some salt. Although taking some salt and get your pressure up, you might just feel like, wow, I can function now. Okay, good. Now you can function, go look for some long-term answers, right? So that's kind of how you would triage that.
Mm-hmm. Great, thank you.
Awesome. All right, thank you. Thanks so much for that. It's been so helpful, and I know a lot of our community loves you. And as I said from the beginning, high expectations, but you always meet them, Dr. Pichon. So James is asking, any ideas to help restore damaged chromosomes and restoring protein integrity where there are, how do you pronounce it, prions? Is that right?
Damaged chromosome? She wants to know how to repair damaged chromosomes.
Yeah.
Well, how does she know she had damaged chromosomes? I'm not aware of any test that does that.
Yeah, I'm not sure. Maybe James, if you're on the call, you can elaborate in the chat.
I'm not really clear on that question, and if it's specifically on how to repair damaged chromosome, I don't have an answer for that. That's kind of not my specialty. I would suppose, though, if you have damaged chromosome, you have to ask why the damaged chromosome's damaged, right? Usually it's due to like oxidative stress, meaning inflammation, really, right? You're exposed to things, you are stressed out, you don't sleep, you eat processed food, chemicals, you're inflamed all the time. These are all things that will cause you to age, things that will cause chronic disease. It's the same thing that causes damaged chromosomes. So don't think about like, what do you do for it or what do you take for it, but think about like, what are the factors that instead of thinking about how to make a bad thing good, think about how to make a normal thing normal again. Because health is normal, right? Health is our birthright, is our normal status. Our body is constantly, every day, as long as your heart is beating, is trying to get to homeostasis, which is health. So if you're not in homeostasis, then your body is trying to. All you got to do is just remove the barrier that's stopping it from getting there. So instead of thinking about, something's broken or how to treat something, think about how to restore something is a better way of looking at it. And restore something is not the same as treating something, It's kind of like the way you get wealthy is not the same way that you would do to prevent a bankruptcy. You know what I'm saying?
Yeah.
To not go bankrupt, you do different things than if you want to get super, super rich. It's two different things. So to get super healthy is not the same as to not get sick. It's different. So think like more on this side of it. Sure. Which is like, hey, how about water? How about chewing your food? How about drinking it, not dehydrated? How about exercise and sunshine? How about nutrients? Like that, right? And then things are broken. Obviously, we got to fix it, but try to think in terms of the other side is better.
Sure, great.
Okay, great.
Awesome. So we have another question from Lisa. I've recently stopped taking a low-dose SSRI for anxiety. Done this 3 times before over the last 15 years. I still get weird bubble headaches, brief, probably discontinuation syndrome. Any suggestions to get through this? I am now taking St. John's wort and 100 milligrams of 5-HTP.
So she has anxiety for many years?
Yeah.
Okay. And she was on
low-dose SSRIs. And over the last 15 years, I think she stopped taking SSRIs at different points.
Okay.
She's been trying to get off them, but she has bad headaches when she tries to get off them. She's trying using St. John's wort and 100 milligrams of 5-HTP.
Okay. So in people who have like, mood issues, sometimes it could be a neurotransmitter problems. Other times it could be like gut issue contributing to the anxiety. And there's also autoimmune causes for anxiety as well. Like you can have GAD antibody. GAD is glutamic acid decarboxylase. It's an enzyme that helps you make GABA. So if the enzyme that helps you make GABA is broken, being attacked by your immune system, then you can't make enough GABA, which is neurotransmitter to help you stay calm, then you can have anxiety. That's very common actually, because that GAD antibody can be present in people with celiac, with gluten sensitivity, and Hashimoto's. I mean, that's a lot of people right there, right? So there could be an autoimmune issue there. But if, speaking strictly about neurotransmitters, GABA is actually a neurotransmitter that's heavily dependent on blood sugar metabolism. Meaning, if your blood sugar is not stable, kind of like what we talk one of the building blocks on the bottom, you're more likely to have anxiety. In fact, one of the symptoms of low blood sugar is like anxiety and irritability, right? Because your GABA starts to like wean, you don't have enough, and you start to feel anxious and hangry. What is that? That's like low GABA. That is a low blood sugar symptom. So the solution to help her wean, it may not be St. John's wort. She might want to look at just her lifestyle, and look at her blood sugar stability. Like, is that working for her? Like, always if you just go to the base, like step by step, then you're going to probably go do all the right things there. And that's probably going to improve things. And if it doesn't, you can always move on to the next part of the ladder and then work your way up. But if that bottom line is not working, blood sugar is not working, she's probably going to suffer from serotonin issues, whether it's discontinuous syndrome or not. That's what I would still continue to do. I mean, she's already doing St. John's wort and 5-HTP, but she's not feeling better. So like a lot of people just think I need to detox it. Well, how do you detox something? It's not that the medication's still stuck in the brain. That's not discontinuation syndrome. Discontinuation syndrome, meaning your brain is so dependent on that chemical. Now that you don't have the drug anymore, it can't function on its own. It has nothing to do with toxicity, really. So in discontinuation syndrome, the goal is to like, okay, how do you get your own neuron to fire so they can make that stuff? Mm-hmm. So then you got to have the building blocks to make that stuff. Sure, 5-HTP is a precursor for, it's actually 5-HTP is a precursor for serotonin, not even GABA. It'll be, other things. But like I said, the blood sugar stability will be really important.
Excellent.
Good angle. Thank you. Love it. I hope people got a screenshot before of Dr. Khan's doodles. I feel like there would be good references for later. But for everyone watching, of course, we'll have the replay of this video so you can go through it again, because I feel like this is a foundational Q&A we're having today. So thank you so much for giving us so much value today, Dr. Khan.
Absolutely.
Are you still taking patients right now? Like remotely?
Yeah, I mean, it's interesting because, with this whole COVID thing, a lot of doctors and telemedicine, they're like, people are doing telemedicine now because they have to. I've been doing telemedicine 100%. I switched my practice completely online, virtual, for the past 2 years, so more than 2 years, actually. So I've been virtual for 2 years. So this didn't really impact me much. It's just business as usual for me. And prior to that, I've been doing some degree of telemedicine for 5 years prior to that. I just basically decided I don't need an office. I'm just going to do this because I can reach more people. So for all you people that's watching, if you guys are like, hey, I wish you were close by, I'm always kind of giggling like, I am close by. I'm right here. You can consult with me. We just got to do a Zoom appointment, which everybody in the dog's doing it. I just been doing it for a long time. So yeah, I mean, I'm open to taking appointments, and I want to help. The thing is, though, people have to come into my clinic, my online clinic, or my ecosystem, knowing what they're getting. They're going to get someone who's not going to tell you, hey, just take this pill, bye-bye. Like, that's not my style. People have to come in like ready to work with me. We're doing this, long term. It's like project. It's like we're rebuilding things from the ground up, taking you through the steps. That's how I do it. Some people just like, hey, can't you just tell me what hormone to take? Wrong guy. It doesn't mean it's wrong. It's just not what I do, and some people resonate with this. Those who do, they come. Those who don't, that's okay. It's just one way. I just happen to think it's a very good way. and I try to explain it to people. And the reason I want to explain it is not to like, oh, come to me, but to let them know that this way will serve them better. Whether it was with me or somebody else, doesn't matter. But this way makes sense because clinically I've been doing this for like 12 years and I've helped over 5,000 people. I have one of the busier practices in the country. And when you've done so many cases and have pre and post testing, you kind of start seeing like, okay, that didn't work. Or that was stupid. Gosh, you started to get frustrated why it didn't work. And you started to work out this model and you realize that, oh, it wasn't the hormone. It wasn't even the adrenals. It was your blood sugar, it was your oxygen, or you're not even chewing your food, or you're in this abusive relationship. Get out of it. Sometimes it becomes like, I don't do life coaching, but sometimes it becomes that like, hey, maybe you need to think about what you're doing for work. What your work is killing you. That's root cause medicine, right? If the root cause is your work is killing you, you do that. You don't go take a bunch of supplements, or maybe you take supplements to get you through it so you can get to the point where you can quit the job and find something else that you're passionate about, right? That's root cause. And that's how I talk. So, if you like that, then great.
Awesome. So Lorraine asked, how do we contact Dr. Peter Kahn? I put in your website, Dr. Kahn. Is that the correct one? Ask Dr. Kahn.
That is the correct one. And when people go there, there's actually it's on my website. There's a place to get started. I actually offer, it's a 15-minute discovery call. It's done by my staff, not me personally. My staff basically will tell you how does it work, how do I do the way that I do things, and what are the expectations, and let you know if you're a good candidate. And then if so, then we can go from there. So that way you can have a little chance to get your questions answered before you even schedule anything with me. So feel free to take advantage of that. Okay.
Yeah, I think that's wonderful. 15-minute call with a coach that you've trained is, I think, an amazing value.
Yeah, absolutely. My coach that answered the call to do these discovery calls, she is really quite amazing. She's able to find out what symptom you have, whether you're a good fit for our practice. It just even just that is really helpful. She'll point you to different things. Like if you're not a good fit, she'll tell you what you can do. So yeah, I invite everyone to take advantage of that if you want to. I just want to have a meaningful relationship with you guys. And I appreciate Sarah and Matt for inviting me. And also for all of you watching, I hope this is, valuable for you. And I will continue to do this for you guys. As often as Matt and Sarah will have me back, I would love to share as much as I can. So.
Oh, awesome. We so appreciate it. And Julie, who is one of your clients, again, she's sounding your praises. I took advantage of that, and the staff is excellent. His nutrition staff is also very helpful. So that's good.
I promise you, Julie,
she's not paid.
She doesn't work for me, and Julie is not paid to say that. Just so you know. Thank you, Julie.
You should pay her. She's doing a very good job. Okay, I think this will be the last question. We've got to, it's almost been an hour, so thank you so much for your time, Dr. Kahn. For everyone watching, make sure you check out Dr. Kahn's YouTube. There's so much good value on there. Lots of lessons. If you're still like, oh, I'm still looking for a doctor, not sure yet, I still want to get more of Dr. Kahn's vibe, definitely check out his videos. Very helpful. I've been on your channel before, Dr. Kahn. I know it's great. So awesome. So this question comes from Jess. She is desperate. She wants a change of plans for her SIBO. So she's been unsuccessful for 7+ years, and she feels that she has some underlying issues that have simply not been found. In the meantime, her microbiome, cortisol, estrogen, and progesterone have gone out of balance quite a bit. I have an underactive thyroid for 20+ years, and I feel that that all up, I've been getting worse. More food intolerances, like fiber, ferments like sauerkraut, and now the hormonal stuff and the microbiome suffering from the restrictive diet. And I'm thinking that my detoxing isn't great either. Her liver, bile, and low stomach acid as well. So she's mostly constipated when on the biphasic diet, and so she's wondering what else she can do differently. She doesn't want to have another round of antimicrobial treatment with little to no effect other than negative outcomes on my large intestine. She's heard about the vagus nerve, and how would she know if that's playing a part? She knows that stress definitely plays a role. So I guess Jess is looking for more root cause approaches.
Yeah. So there's a lot there. So
Yeah.
this is Jess?
Yeah.
Okay, so Jess, this one's for you. But I think for many of you, this will also be a great learning, experience. So thank you, Jess, for sharing your symptoms, because you're kind of opening yourself up and allow other people to learn from you. So do you guys mind if I draw one more time to
Yes,
kind of
please.
finish this up?
Go for
Okay,
it.
last one here. I'll try to be kind of to the point here. Okay, so so Jess has SIBO, right? But she also has hormone problems, specifically she mentioned cortisol. There's also microbiome issues. Obviously, when you have SIBO, there may be microbiome issue as well. She had underactive thyroid, food sensitivity, and there's that stress connection. I'm going to try to link it all together for you. So here we have, remember we talked about how that T helper 2 and T helper 1, okay, kind of put it backwards here, but when you have high T helper 2 response, you're going to have low T helper 1 response. Remember, all of this are driven by inflammation. So what happens when you have gut inflammation, that's going to drive this increase in T helper 2, which is your antibody response, which means that you're going to have more histamine. And Th2 response drives more histamine, which is your allergic response, drive more mast cells. So people get mast cell activation, drive more eosinophils. Eosinophils is a type of white blood cell that can be seen on your regular blood work. You're going to see that number high, which indicates that you have some kind of gut immune response, okay? And then what that does is it's going to decrease your T helper 1 response, which makes you more immune compromised. And now you can't fight off infection as well. So this is why some people will get like bacterial infection, but then they also have virus, right? Epstein-Barr, they got like 5 different viruses. Like, how do you get 5 viruses? You didn't catch 5 viruses. You just couldn't fight off the virus that you come into contact with. Does that make sense? So then you get these infections. And what happens is, so this makes you more likely to get infections, right? That drives, so it becomes a chain. Now this infection then will come back, and this infection could be gut infection, like bacteria, like SIBO, right? That's your SIBO. And that could be your candida, which is your SIFO, even parasites. So this is going to drive this, which with all these infections, it's going to drive more gut inflammation. And there you go again. You got a loop right there. Okay. Now what happens is when you have this gut inflammation drives increased systemic inflammation. Okay. The systemic inflammation drives this T helper 17 response. So, whoa, Th1, Th2, you got T helper 17? Yes, this is another type of immune cells. These guys basically are there to supposedly help you get rid of infections. So they're dispatched when you have infections. So the more of these infections you have, the more that increases that. And then also T helper 17 drives autoimmune disease. So what happens is you have gut inflammation. Now you have this increased allergic response with a Th2. While you suppress your immune system, you can't fight off infection. So this makes you more susceptible to SIBO, bacteria, candida, parasite, and viruses, which drive more gut inflammation and start this vicious cycle. At the same time, you become more systemically inflamed, which drive T helper 17, which really drives autoimmunity. Remember earlier I said when you're autoimmune, you're inflamed? That pathway is right here. The more inflammation you have, the more autoimmune you become via the Th17 pathway. So now you become more autoimmune. And that autoimmune activation then start to cause more problems. So now here, remember the systemic inflammation will go ahead and drive brain inflammation. So there's your gut-brain connection right here, folks. You guys all hear the gut-brain connection? There it is. The gut and the brain's connected through systemic inflammatory cytokines, through these different immune cells. Now, when your brain becomes inflamed, guess what happens? You get decreased vagus nerve function. And when you get decreased vagus nerve function, you get decreased motility. So now you're constipated, right? Now you're constipated. And then when you're constipated, that makes it more likely that you have SIBO because things are not moving through. So food that just sits there, it ferments with bacteria, you get more SIBO. Can you guys see this? Is this making sense? Yeah. This is how people become autoimmune, have chronic inflammation systemically, you get joint pain, and then you also have brain fog. So now you have digestion problem. Oh, I have gas and bloating. Oh, and I also have autoimmune. Oh, and I hurt all the time. I'm inflamed. Oh, and I also like get sick easily from viruses. Oh, my hollow space, sinus and bladder. Oh, I also have brain fog and depression and can't focus. Like it's all connected, folks. The brain, the immune, and the gut is all connected. This is how. I just gave you a visual representation. Now, I didn't even throw in here stress, blood sugar imbalance. I mean, that can fit. I mean, I just need to blow this up bigger. We're running out of time. But to answer Jess's question, like this is why this is. So there's not like, hey, just take this, right? We have to kind of actually unwind this. So a lot of times for people, we might start by working on these Th1, Th2 first. And then as we move along, then we'll start to get rid of infection next. Because if you try to get rid of infection, but your immune system's not even working right, taking anti-inflammatory or taking antimicrobial herbs, you can't get rid of infection anyway because your immune system's not working. So we may have to improve your immune function first. And as we do that, then we can get rid of infection. And as we do that, then we can decrease systemic inflammation. And we have supplements that we can do for that. And then as we do that, your immune system gets more balanced. Then you're less autoimmune. That's how you do this, right? And then as all this thing improves, your brain inflammation go down. So your brain becomes more clear and vagus nerve comes back online. And then because your vagus nerve coming back online, because you have less brain inflammation, now when you do the vagus nerve stimulation exercise that I famously teach, then it'll actually work. So a lot of people doing vagus stim, it doesn't work because your brain's so darn inflamed that no matter what exercise you do, there's no juice there to even be stimulated. Consider that, okay? So hopefully that helps. You know, Jess, if you need help, just give us a call. You know, I mean, we probably should have a talk. So.
So
Sounds
good.
like it. You are brilliant. We love you. Goodness, Lover, the Gut Solution, the Healing Key crew love you. Thank you so much.
Thank you. Thank you for having me. And hopefully this was valuable for you guys, valuable for the audience. And, you know, and I want to say, you know, for many people, if they just do the basic stuff, like for I think takeaway, right? Balance your blood sugar. That means don't eat too much carbs and sugary stuff. And you know, and for people with low blood sugar, you might want to eat more frequently. Intermittent fasting may not be the thing. Like fasting and intermittent fasting is so popular. Some of you can't do that. You fall apart when you do it. So don't do it. So but you know, all these books, you know, all these books and the podcast says it's good. It's good for people who can handle it, but not good for you, right? This is individualized medicine. So maybe you shouldn't do that. For people who have insulin resistance or diabetes, maybe you can fast. But even for them, they may have blood sugar up and down like a roller coaster. It's not high all the time. So they may have to start by eating more frequently, right? And then oxygen, you know, you can do salt water, but you got to kind of find out why it's like that. You may need to have a blood test to make sure you're not anemic or iron deficient. Check it, right? If you don't have a doctor check it with you or they won't do it, don't do it comprehensively, you know, talk to us. We can help you with that. And then, you know, chew your food, manage your stress, all the stuff that we talked about today. Sarah asked, is stress a big deal? It's a huge deal. Stop looking for a pill. Start meditating maybe, right? Do that first before you start to take all the stressing about what supplement to take. Meditate and change your stress level. Do that, right? And then if it's just not solving, not better, yeah, you know, talk to somebody and get some tests done instead of just keep trying to take more and more supplement. Like if you're taking more than 8 or 10 supplements, I think you have a problem. Like it's not working. It's probably not working that great. You know, on average, my clients take like 5, 6 supplements because like we're targeting one step at a time. We have lab tests to confirm that. So we're doing, okay, this is where you're at. We're just doing this. So if you're taking like 10 supplements, you're taking 15 supplements, way too much. I mean, just put in a chat so Matt and Sarah can see. I'm willing to bet that there's a lot of people who's taking 10 supplements or more. Go ahead, guys. Put in the chat box how many supplements you're taking. Okay. Okay, we got some 5s. Okay, that's good. That's on average. 12, we got a winner.
James, 1.
Okay, 14, 8. Okay. I mean, You'd be surprised how many people are taking like way too much. If you're taking that many supplements, you're probably just guessing at what's going on, and perhaps it's not that helpful. And even if it helps, it's not a way to live to take 15 supplements. How about we make it down to like a 5 and you save a bunch of money? How about that, right? So yeah, anyways, hopefully that helps.
Oh, wow. Thank you so much, Dr. Peter Khan. You saw before that everyone chiming in on the thanks. People, obviously our community loves you and they identify the brilliance and simplicity. The way you teach, I think, is really cool. Coming from a lot of experience of helping thousands of people, but sometimes a teacher is better measured by how simply they can explain things and convey those advanced concepts, which you've done brilliantly today. So thank you so much.
Thank you so
Thank you.
much.
I'm grateful for the opportunity. Thank you so much for having me. It's always a pleasure.
We need to get you on our new podcast, which, by the way, if anyone was on last night with Dr. Bulawitzi Witz, we had all our fancy new equipment and it failed us. So we're re-recording it right now so we can get that recording out to you. But we want to have Dr. Peter Khan on it as well.
Yeah. Now that we've fixed our problems, we'd love to have you on it.
Okay, great. Yeah. I'm more than happy to jump on and contribute. Absolutely. Just let me know when.
Yeah, we had a few hundred people on the call and it just completely failed.
We lasted 4.5 minutes before it crashed.
So
bad.
I'm glad I'm not the first one up then.
Very embarrassing. So we apologize to everyone.
I know. So sorry, everyone.
Hey, this is just another lesson for you guys. If they ever come out with a COVID vaccine, don't be the first one because it might fail too. Just like you're the first one, you're the one being experimented on. It may not work. So
don't want to be the bad pancake, right? The first pancake. All right. Thank you, Dr. Khan. We love you. Everyone stay safe and we'll chat to you soon.
All right. Thank you. Take care. Bye-bye.
Bye.